Hi everyone, Amber Canoy here with Everyday Kentucky, and Erin with Associates in Pediatric Therapy is with us today, and she's going to tell us all about my new friend here who we have a love of everything superheroes in common already. So tell us a little bit about his background and why his parents decided to come to you all.
So this is JR. He is 3 years old, and he has been coming to see me for speech therapy now since the summer. And his mom reached out to us to do an assessment just because he's not talking and saying saying longer sentences like a child that his age should be. So I did an assessment, and what we found after that was that his understanding of language is perfect. I mean, he can follow directions. He knows when mom asks him to go put his shoes away. He understands everything, but just as he is trying to speak words to us, they're not coming out clearly. So we have started some therapy. He comes to see me one time a week. We work on all different kinds of things. We work on imitating just sounds by themselves, some early vowel sounds like A and E, and then we work on imitating some consonants like M's and B sounds. H, we're working on saying the word help. And he is just doing excellent. He loves to come and play. He likes superheroes. We do Mr. Potato.
And you're using a lot of technology too to help him be able to communicate.
Yes, it is an app that we use where he can tell us anything that we program in here for him. Wow. We have really just started on some basic things. We call them core words. Let me turn it up here a little bit. We work on asking, like, I want something to go if we have cars or trucks. Sometimes I'll make them go and I'll just model for him, like go and stop, kind of some of those opposites.
He says, no way.
No way, no way.
But this is great to know, because a lot of parents might, be a little disheartened, but they can still communicate very effectively and still grow.
Yes, definitely, definitely. He can tell me I want more of something. He'll tell me I'm all done with something. Up, up. I think we've stacked blocks before, and we make them go up, 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 and then they fall down. And what this device also does is, I may model a word for him like up, and he'll repeat it sometimes, or like if mom says it, sometimes he'll repeat it. But with this app, he is repeating the words and learning them.
He knows exactly what he's communicating.
Yes, and he's hearing it, and he is repeating it with greater accuracy every time he says it.
So if there's parents out there who maybe are in similar situations where they might think that their child needs to have an assessment, they should just contact you all?
Yes, definitely. So at Associates in Pediatric Therapy, we offer free screenings for speech therapy, occupational therapy, and physical therapy. And then if they feel like a full assessment would be needed, then we would get with that child's doctor to get a prescription, and then they would receive the full assessment, and then the therapist would speak to the parent about what would be addressed in sessions.
All right, well, I know if anybody out there has any questions, you can give them a call, and hopefully they can help get you some answers and possibly use some of this technology that is just really helping little ones like JR communicate more effectively.
Hey, do you want to tell them what your name is?
My name is JR.